It amazes me that anybody can make it through the healthcare system at this point, because it is so complicated, and they just give up, because everywhere they go there's just this big brick wall, and they don't know how to get through it. And a lot of what we do actually as nurses is being a patient advocate. And you spend a lot of time trying to break through these walls, because you may go in the job that I'm doing now in home health and hospice, and especially just say in home health, you'll go in to see a patient for wound care, and then you'll find out that there's 50 other things that are wrong. And why hasn't this been taken care of? Well, they just don't have the money. They can't afford the prescriptions. They just let it go. And so you spend a lot of time. I mean, some people will just go in and they'll do the wound care, or you go in and while you're in there, you try to take care of some of these other things and at least get them in the right direction, if you can do that. A lot of them they spend all of their money on health care and prescriptions. I could tell you about lots of places that I've been in, but one home just recently, and that was north of Newport. There I went in to do wound care on a patient, and it was this little small apartment, and they had, I think it was like 9 people living there, because they can't afford to have a bigger place to live. And so in the living room there's 2 hospital beds, and 2 different grandparents from all of this, extended family living there, young kids, teenagers, young adults, and the 2 hospital beds that are taking up almost the whole thing. And that's how they live from day to day. They don't have any money to do anything else. And that just takes up everything they have. And they're scraping to get the prescriptions for both of these older, family members. Some of them work, and they trade off taking care of the family members. And some of them, and these 2 women in particular, one, has to be cared for all the time. They're not paid caregivers. A lot of people do get paid, if they qualify, they can become paid caregivers, but they're not. So they try to trade off, and they've got like the teenagers watching them while they run to the store, or some of them are working and some of them aren't working, and it's just mind-boggling to imagine how people can exist like that.